We will now be moving on to our next panel. I would like to briefly introduce each of our speakers, starting with Sahaana Sankar. Passionate about the development sector and creating social impact, Sahaana Sankar is the Chief Operating Officer at Hand in Hand India, an organization that fights poverty through job creation across 16 states in India and 7 countries. At Hand in Hand India, she spearheads the communications department and supports strategy and fundraising. Prior to this, Sahaana has held various leadership and editorial positions during her education. She has worked with a startup, Wimbletech, in the UK for a year as the financial and community manager, where she handled the audit, accounts, and expansion strategy alongside a small team. She has also worked with the United Nations Chief Executive Board in New York. Next on our panel is Dr. Sathish Kumar Angappan, who is Country Director of Saathii, located in Chennai. He received his MD in sexually transmitted diseases from the Tamil Nadu Dr. MGR Medical University. His technical expertise includes supporting government and civil society agencies in designing and delivering comprehensive and quality prevention and care services to HIV-affected families. He has over 14 years of experience in areas of STI and HIV prevention, care and treatment, and maternal and child health, and has been instrumental in the expansion of Saathi's programs in these areas. We now have Vijayalakshmi Mohan, who is a passionate educator and an alumna of Teach for India. She leads partnerships foundation, leveraging the power of a collective to establish meaningful collaboration with various stakeholders to transform education outcomes. Over the course of her experience at Teach for India, as well as at Vadai, a grassroots NGO working in Villupuram and Dharmapuri, Vijayalakshmi has gathered insights on school systems as a microcosm of the larger education sector, and on parental attitudes and influences towards their child's education. As a recent postgraduate of public policy at Takshashila Institution, Vijayalakshmi has also had the opportunity to add to her field experience a deeper understanding of the theoretical and practical underpinnings of policy-based educational reforms. Facilitating this panel will be Professor Andrew Sesuraj. Professor Andrew Sesuraj is Assistant Professor at the Postgraduate and Research Department of Social Work at Loyola College. He is an empaneled child protection consultant with UNICEF, an honorary coordinator at the Child Friendly Police Initiative, and the honorary director of Loyola Knowledge Hub for Excellence in Child Protection. He has also trained over 2,500 police personnel as child welfare officers in 2018 and 2019. Professor Andrew has been the state coordinator for the Tamil Nadu Alliance for Right to Education and Equity, networking with 150 non-governmental organizations at the state level towards free, compulsory, qualitative, and equitable education to all children. I welcome our panelists and hand over the conversation to Professor Andrew to take it forward.
Thank you, Vedika, for the introductions. Since the time is very short, let me not spend much time on getting into the basics. But what is very important is that this session, okay, which is supposed to be understanding the voice of growth, where we speak about the structures and strategies and how to ensure that there is a culture of leadership is emerging in the social sector, and also the role of collaborative action for implementing the impact and scaling the impact. So I think I invite the panelists to concentrate on this. And do we have an order, Vedika, that who is going first? Anyone already? Or we can go as per your the sequence of your introduction. I think Sahaana was introduced. Can we have Sahaana in the first? Is it okay?
Sure, sure.
Okay, Sahaana, let's move on.
Yeah. Good morning, good afternoon, everybody. Thanks, Vedika, first for organizing such a great initiative, because I think young leaders and leaders in the NGO sector really need such platforms to collaborate and come together. And it just so happens to be the topic of today's discussion as well. Professor Andrew, what would you want me to address first? Do you want me to talk about how hand in hand has different structures and strategies that has led to impact at scale? Do you want me to start with that first?
As you should be knowing that Vedika has already shared some 4 questions.
Yeah.
So
do you want to do it question by question, or how do you want to
I would prefer going question by question. Shall we go with the first question of what are some of the structures and strategies that facilitate impact at scale?
Yeah, got it. So at Hand in Hand India, I think 2 very important pillars that we focused on in this 16-year journey is having a vision of scale and sustainability, because only if we have these 2, we can really reach the impact at the field level. So this has been one of the key reasons why we've been able to achieve the numbers that we have over the last 16 years. So how do we go about this? There are a couple of strategies that we use. When we pitch for projects, we really take the cause. We do a lot of research in designing the proposal, really understanding the geography, the community members we're working with, how the program is going to impact them. We look at ideas that are innovative, and we always have the big picture in place. Another thing that we do is constant monitoring and evaluation. We have an in-house team where in the beginning of every project, we have very enumerative baseline surveys. We have a midline survey where we do a lot of mid-course correction. We interact through focus group discussions with the field, with our staff, interact with the community members. We learn, because every day things are changing on the ground. What we write in a proposal may not actually be what's happening in the field. And we also have a detailed end-line survey to really capture the impact. So I think monitoring, evaluation, and documentation is something that we've specialized on in over a decade now. And I think another thing we really focus on is not very short-term projects. We try to pitch for projects that are longer term, maybe 5 or even 10 years, because only if there are long-term projects like 7-10-year projects, we can really measure and quantify impact. We can measure behavioral change in communities, and very small indicators can be really quantified only if we have long-term projects. So these are some things that we focused on as a team to ensure that we have impact at the scale that we have currently.
Great, Sahaana. And may I invite Madam Vijayalakshmi to address on the same question?
Sure. Good afternoon, everyone. Thank you so much, Vedika and Yusmani, for coming up with this amazing initiative. I think it is definitely the need of the hour. And personally, as a person who has worked with the partnerships team in my organization, I definitely resonate with this idea as such. So moving on to the question as asked by the professor, I think there are 2 sort of lenses through which Madhi Foundation has sought to address the things that we need to consider for building structures and strategies to ensure that there is long-term impact at scale. So the first, from a programmatic lens, we ensure that the program design itself is sort of very strongly rooted in the context of the problem that you're trying to solve. So what is the problem? So arrive at a very sort of concise problem statement and sort of design your program to address that root cause of the problem. That will be on a programmatic lens. And moving on to the organizational development lens, we sort of look at starting from having a very strong hiring strategy, a very, very robust hiring strategy where you hire people with sort of the right skills, right? So that's very, very crucial. The second would be, I think, very similar to what Sahaana said about having robust monitoring and evaluation procedures and research methodologies in place, because it's very, very crucial that you not even to understand what is existing in national and international sort of the landscapes, to understand what can actually work in our context. So what is the target group that we are looking to address, and how can we sort of learn from different landscapes and apply it to the context that we are trying to solve. That is the
that's all.
monitoring and evaluation piece. The third most partnership strategy. That would be the final piece. Given that we are working at scale, if you want to change, it cannot happen in silos. It's very, very crucial to sort of collaborate and make change possible. Yeah.
Great. Yes. As Sahaana and Vijayalakshmi was explaining, it is the research, understanding the contextual need, or contextually rooted, along with understanding of the geography through the help of baseline surveys, or constant monitoring and evaluation. Okay, helping to develop the problem statement. This helps in the basis while we start our interventions. Now, since Mr. Sathish is not joining now because of some technical issues, he is expected to join. Until then, we move on to the next question. How may leaders ensure that the culture of the organization as a whole align with those of its members, or vice versa? Shall we start with Vijayalakshmi this time?
Sure. So I think for any organization, speaking purely from my experience at about 3 organizations that I've volunteered and been a part of, it's very, very crucial that the culture of an organization should be such that it celebrates and the individuality of every team member, and also sort of as a collective aligns with the overall vision of the organization. So that said, just a couple of strategies that we try to adopt to ensure that every team member is on the same page as far as culture alignment goes. We have a very, very robust selection process where we give, if not the same, I would say even a little more importance to culture fitment, because given the context that we are working with, and given the different partners and the sort of uncertainty that is sort of prevailing with different programmatic scenarios. So it's very, very important that everyone sort of comes with that sort of understanding that change will happen, but it will take time, and sort of those values and mindsets are very, very critical. And we ensure this by even allowing some team members to have a trial period in the organization. Let them sort of ruminate with the organization for a while, figure out what works, what doesn't, and then sort of take the final call of joining the organization itself. So culture fitment is very, very crucial, and I think it's a very, very critical piece for us as an organization.
Great. No, this the trial period is something new that I'm also hearing, because we have heard of the probation period, where the organization tries to understand the person and gives them the person whether he is capable of joining and aligning with the vision. Whereas you speak about a trial period where the employee or the staff or the person who joins the organization has a trial to understand whether he is aligning with. That's a very good, I think, and also celebrating the uniqueness. Sahaana, it's over to you now.
Thanks, Professor Andrew. I agree with Vijayalakshmi that it's so recruitment and recruiting the right staff with the right cultural fit, I think, is so important, because I completely echo with that, and we do that at Hand in Hand as well. But I would answer this question from the other end. As important it is as it is to recruit the right staff, I think the culture itself should be emulated by the leadership and the founder, because without that, what is the organization culture, and that person should define it. I think at Hand in Hand, and I vouch for all the staff, which is fairly large number speaking, that we have like an excellent founder, Dr. Kalpana Shankar. She really emulates everything that we work for and everything that we believe in. She's very competent, and I think more than anything else, she instills a value of ownership in the work we do amongst all the staff. And this is the kind of culture that I think all of us carry on our back, and Hand in Hand, we're like a family, and it gets, it's almost in our blood. And how does she do this? I think is lot of communication, not only from her, but from the senior team. She directly communicates with right to the field team. I think keeping channels of communication, building relationships with the staff, and constantly reiterating our values and purpose creates a lot of trust amongst the employees, and this trust also translates to the beneficiaries and clients or customers we work with. So they also believe in us as Hand in Hand as an organization. Is okay, we know these people, they're really good, they have good values, we can trust them, they're coming to us with a program, this must be something in it for us. So that's the kind of leadership she has inculcated. And also there's a lot of creativity and autonomy that's given to staff at Hand in Hand. Of course you have your project work, but you also have the scope to innovate and really stretch your boundaries to impact at your own level also. So I think that is very important in any organization.
Well said, Sahaana. Like as you said, translating our vision, translating our vision and making our beneficiaries as partners. Okay, that's where the leadership matters. Otherwise, they will just remain beneficiaries and will become benefactors, and it will be only like a welfare approach. Unless you make the people with whom you work as the partners, the reaching out to the vision, the objective, will not be sustainable. I think you very well said. Yes. Dr. Sathish has joined now from Saathii. Sir, we are in the second question now. Maybe I can read out the question for you. I think we can directly go in front of the second question. Are you ready, sir? Sathish, sir, are you ready? Am I audible to you?
Hello.
Am I audible, sir?
Hello.
Yeah, we can hear your voice, but it is feeble. You can make it a little louder.
I think I'm facing some technical problem.
Now,
Sir?
Now it's good.
Yeah. So, sorry, I joined little.
I understand, sir. Shall I read out the second question for you, sir? So you have put your mic, you have switched your mic into mute mode now. You have to unmute now.
Yes, yes.
Yes. Okay, sir. I'll read out the second question for you. For that, we can start answering. How may the leaders of the organization ensure that the culture of the organization as a whole is aligning with those of its members, so that we'll be able to ensure that we create an impact in the society and we create a scale?
Yeah. Okay. So thank you for this wonderful opportunity, and nice to connect you, Professor, and all the team members here in this NGO talk. Yes, as such, we are seeing how NGOs, are making a big, dent in the minds of people in trying to access services. So how the organization's culture is very important in the development sector is a core focus. So as an organization, Saathii, we are working for the cause of HIV/AIDS, TB, maternal child health. Ours is a public health organization working across the country. And so based on that work experience, which I'm part of, I'm very happy to share our experiences. Any organization looks at primarily the culture, depends primarily on what is that, the goal which we are trying to drive towards. So as a public health organization, our experiences are deep rooted in terms of the growth of the staff. So the organization culture depends on inculcating the very good learning atmosphere among the organization, where cross-sharing and cross-learning is very important, where we have 14 offices across the country. So what we do is, first, whenever we have the staff in place, the most important thing is having a very good induction and program management training, so that the staff are aware of what is the most important purpose of their project and how they have to go ahead in that way, and try to have a very good training on program management systems, so that they are oriented on that. So when any organization gets established and then grows up, the most important thing is our performance, to really make the outcomes of the project project to be successful. And so if we have a very clear team in place, that will be very good. And so that is first. Second, on an ongoing, when we start implementing the projects, we have multiple learnings coming from various teams. So the cross-sharing learning is the most important thing. So what we do is we have e-groups for individual projects, we have e-groups for an office, and we have e-groups across the country. So what we do is we share all the learnings from one project to all the projects. And we have specific groups for directors and managers, so that we also immediately quickly share the learnings within the directors. So by doing that, there is a quick cross-sharing learning happens. That is second. And the third point is also giving specific autonomy to the team members and the freedom as we build the projects. We also give space for the staff to grow and express their ideas and thoughts. So the important thing is building second level leaders. So as when one project ends, when we go to the next project, we found a lot of leaders coming out passionate about the work which they do. So we focus very much on those kind of budding leaders and build their capacity and give them space and freedom so that they develop new projects and then go. So by doing that, we have been able to create platforms so that people can grow and then they can also build more projects on their own. And there is a strong amount of ownership within the project. We see that.
Great.
These are the points.
Yes, sir. Great, sir. As you said, induction training clarifies the vision of the organizations to the employees. At the same time, you also speak about the autonomy of the individuals. It's about balancing between the induction where I give what is expected, and at the same time, I also make sure that the autonomy of the staff is respected. Yes. Now we move on to the third question, and before that, a small reminder: we have only 15 minutes left, and we have 2 more questions to go. So I request each panelist to respect 2 minutes for each answer, so that we'll be able to manage the time. Thank you. The third question will be: what is the role of collaborative action in implementation and impact at scale? Who are some key stakeholders in such partnerships? This time, shall we start with Mr. Shankar? Mr. Sathish?
Yeah.
Yes,
yeah. So in terms of collaborative action and partnerships, the most important thing in all the projects where we work, whether it's HIV/AIDS, TB, maternal child health, all the projects which we do, definitely I think all of us who are experienced here would definitely build the projects based on the requirements from the community. So our projects, as we build it based on the community requirements, the most important principle is about community engagement. We have seen HIV/AIDS, TB, maternal child health, and the vulnerable groups of lesbian, gay, bisexual, transgender population, or other vulnerable groups like we work with tea garden workers in Assam. So wherever we work with specific group of population, there is a very much important element of consumer or customer or our target beneficiaries involvement process is there. So the first most important thing is when we work and engage with communities, they give us solutions, they give us also thoughts about how projects can be designed and implemented. And that is the first most important thing in that. And it builds ownership and it builds a lot of confidence on the project implementation. And also it helps us to sustain when we move towards the project various phases of cycle. That is one. The second one in the partnership is about, there are 2 kinds of partnership we talk about. One is funded, other one is non-funded partnerships. So primarily we map the stakeholders. Most of our projects, we map the stakeholders. All of us do that very much. And create platforms for the beneficiary to talk with the government officials. So be it, for example, HIV or LGBT, lesbian, gay, bisexual projects, or TB, we see that not just health is a core important thing, but there are other determinants that play around, be it a socioeconomic barrier or a stigma issue or a social justice or empowerment. So we also, our program people meet with departments and create platform for interaction with the community. I may have differences of my understanding based on my lifetime experience about handling lesbian, gay, bisexual issues, or a HIV issue, or a TB positive person issue, or a person from a vulnerable group. But when they start interacting and then start speaking to people, then the barriers break up, and then they try to relate with people and then come out with much better things. So we were able to really see access to schemes, crores and crores of rupees for LGBT community, HIV population across several states and districts we work with. So that is the second one. So in the partnership, most important thing is building platforms. And the third one is we work with private and public health sector. We run one of the largest private health sector in close to 24 states in India, where we work with close to 25,000 to 30,000 private maternity health facilities in testing HIV in pregnant women for HIV and deliver HIV services for them. So it's a big program where 25,000 obstetricians are involved, and that was possible because of the professional medical associations like Obstetrician Gynecologists Association. In TB work, we work with pediatric associations like that. So when we bring platforms where the community, TB people, HIV people talk to the private doctors, there is a change that is happening, and they start delivering services that breaks the stigma and also things, and they're both able to communicate, talk to each other. That is the third one. So then the last one is funded partnerships.
We are running out of time, sir. Make it short, sir.
Yeah. So last point is funded partnerships. So always when we work for partnerships, provide funding, also engage community, build community structures, and so that the community also runs small portion of the projects. Over a period, you handhold them and then give it to them some of the projects so that they sustain the efforts. These are the overall learnings on partnerships and collaborative work.
Great, sir. Thank you, sir. And there's a request to Sahaana and Vijayalakshmi that maybe the third question Vijayalakshmi can answer, and the fourth question Sahaana can answer, so that we can try to make some time. Is it okay?
Sure, no problem.
Thank you, Sahaana, for allowing the space. Yes, Vijayalakshmi, you can move on.
With regard to collaboration and stakeholders, is that correct, Professor? That is the question, right?
Yes.
That's the
yes.
third question. Okay.
Yes.
So at Madhi, so for us, I think collaboration is the sort of a cornerstone with whatever projects that we build. So we work very closely with the education department in the state, and we believe very strongly in institutional capacity building. So when we look at state as a unit, it's not just at the state level. We see who are all the different officials in the value chain at the state, district, maybe other administrative levels below that, right? Say in a school ecosystem, school would be the smallest unit, and then a group of say 10 schools called a cluster, and then another, the administrative block, and then the district, and so on and so forth. So engaging with multiple levels of official is very, very crucial. So that would be on the government partnerships front. On the donor partnerships front, I think I definitely resonate with what Dr. Sathish just shared. So on the donor partnership front, again, there are sort of two types of donors. There are donors who sort of build capacity of the organization itself to serve the target group that it intends to benefit. And also there are sort of donors who sort of fund and we sort of are held accountable for. So there are different types of donor partnerships also, which we very strongly believe in leveraging. And the third important partnership piece is the external partnerships, where we look to sort of collaborate with different, say, non-profits or for-profit organizations in the education sector, facilitate the cross-learning to happen, to ensure that we don't sort of reinvent the wheel every single time. So, and there are different organizations with a lot of experience out there in the field from whom we can learn so much, given the wisdom that most of them have. So that is also something that we look to strongly leverage. So these three are the key partnerships and the stakeholders that we look to.
Great. As you said, it's about the multi-layer partnership, because it's about one level, you have to look on the policies, you have to align with someone. For actions, you have to align with that different layers of the officers. And yes, I think that makes a very real sense. Now we'll move on to the fourth question. How do we ensure your organization's large scale impact is also sustainable and qualitative? So I think this everyone needs to answer, but I think everyone can take 1 or maximum 2 minutes, because we have only 2-3 minutes only left. So please, because we have to give space for the audience also.
Can I
start with the Sahaana? Yes.
Okay. I think this is a very important question, maintaining quality as you grow and how you can become sustainable as well. As with any institution, NGO or not, when scale comes, there could be an impact on the quality of the services that you deliver. But at hand in hand, we have tried our best in every aspect to maintain quality along our growth journey. We've done this by using a couple of strategies. We have a strong internal audit team where they audit our ongoing projects, give feedback regularly every quarter, so we kind of improve, look at what we're not doing right, and come back on the right course. At the end of every project, we have external evaluation and impact evaluation, which adds a lot of credibility to our work, and which is very instrumental in getting further funding for the growth of the project to make it more scalable and sustainable. And last and most important, I think hand in hand has a very eminent and professional board of trustees. I think the role of the board in a non-for-profit organization is very critical. They are very hands-on, they advise us, they tell us the best practices, course correct and guide us. And I think that really keeps us on track, maintaining quality when we grow. Coming to the sustainability part during our growth phase. So 15 years down, we work in 5 different areas, and we have created very good models in each of these areas. So originally, all of us here have set up organizations as a trust and NGO, because that was the most conducive and easy type of organization to set up for doing not-for-profit work. But I think that there should be a transformation to sustainable social enterprises at some point. Like how we've done with our waste management company, we've hived it off into a Section 8 company, which is for profit, and some of the profits are plowed back for employee salaries, administrative expenses, and I think you have to spend on even branding and marketing. I think it's become like a corporate almost. So this transformation of the traditional NGO to sustainable social enterprises is one way to look at sustainability, and I think also training more people. We have an academy for social entrepreneurship as well, training more people who are interested in the field and bringing them into this fold, so more people at the bottom of the pyramid can get impacted, because ultimately we want to fight poverty or work towards whichever causes we're working with on large scale.
Thank you, Sahaana. Now we move on to Dr. Sathish.
Yes, sir. I totally agree with the points which Madam Sahaana said. So I like to add just one or two, is that most often some of the health from public health projects where we build in, if we align with the national programs requirements and have projects inbuilt within the overall visionary of the country's health goals, we would be able to understand and work in that direction and have projects in line with that. So when we do that aligned projects, it would be much easier to build projects and also sustain it in the hands of the government. Sometimes our projects may end in a short period of time, but still the core success and the learning would be continued by the government. There are some projects where we have done model projects and then advocated with the government to scale up. In TB, in HIV, in several places, we have done public health projects like that. That is the core message I would like to share. And with the communities, similarly, we shouldn't be refrain or afraid of sharing the learnings with community members. Most often, some of the core skills we teach them, but then we don't tell them the other skills. So in the communities, when we build the capacity, we should also build a capacity on comprehensive skill management, so that they holistically sustain themselves and not just work on one thematic area. So these are the two components. Thank you.
Great. Vijayalakshmi, yours.
Sure. I do not have much to add. Honestly, I think most points are covered. Just adding a couple of thoughts here. Just in line with what Dr. Sathish just spoke about, building capacity of the government and sort of building pilot models which can be slowly phased out and adopted by the government. That has been our approach towards ensuring sustainability in the long run too. So a couple of points I would definitely definitely like to point out is, first, it's very, very crucial to document key learnings and sort of make it available to all stakeholders, right? It's very, very important that multiple people learn from whatever it is that the entire landscape can benefit from. So it's very important to sort of synthesize your key learnings, and because it may become a policy change in the long run, and that is how any solution can sustain itself. The second thing would be
also.
Absolutely, yes. And the second thing I think closely ties with this is transparency. however the pilot sort of pans out, it may be right, it may go wrong, but it's very, very important to be transparent so that the accountability is sort of built both ways there. And I think that helps in the longer run where trust is also built from transparency. Yeah.
Great, great, thank you. And there is one question, we have only 3 minutes left. There is one question. How do you motivate your people, your staff, to remain committed to the values like integrity in a challenging environment like today we face? Any who wants to volunteer to answer this question?
Yeah, can I? Sorry.
Please, Sahaana.
So I think, as I mentioned in my, I think, second answer, I think the leader emulates this integrity and honesty. So that's something the staff should definitely follow. And even the board, if the board is very transparent, and if all the processes within the organization is transparent, I think only that kind of staff will be attracted to the organization as well. And we have to keep reiterating this as well. Even if you may be a very honest person and you may have high integrity, but it should keep coming up in conversations, in the decisions you take, and even in the trainings and the strategy meets you organize. It should be reinforced as well. That's my
Thank you.
take.
Thank you. Do we have any other questions, Vedika?
Yes, Professor Andrew, I've pasted it into your chat box.
Okay. How do we move beyond collective impact as a rhetoric and politically correct phrase to actually practicing it? The collective impact beyond using it as a phrase, how we can actually practice it. So that is the question. And Vijayalakshmi, I think you are ready to answer.
Sure. This is something that excites me, so definitely
Okay,
I'll give it a shot. I think very clearly said, right? It sort of has become a rhetoric. I think we need to come off that culture. It's very, very crucial. And how do we actually do it is by honestly adopting a very, very wholesome partnership strategy. So it's very similar to what I think spoke about briefly in one of the questions on the key stakeholders that we're looking to impact, right? So whatever program it is that we are designing, it's very crucial to map the stakeholders who are sort of impacted by that program and see what can be done and what is in it for every stakeholder. So why should an ex-stakeholder be a part of this program? What are the benefits that they can probably accrue? So those items and other sort of influencers and the sort of power dynamics. I mean, these softer elements and need to be considered when you very clearly sort of map the stakeholder activity. And I'm sure it's easier said than done, but it comes with years and years of practice. I'm sure like Sahaana and Dr. Sathish are just spoke about.
Yes, yes, well said. Yes, we are on time. It's 12:40. We are closing with this. And thank you for the panelists, because it was a very learning experience to listen to all of you, especially when we spoke about the change makers and the impacts we are creating in the field. It is also important that how we are working, it has to be translated into action and translated into document so that it becomes replicatable models for those change makers who are willing to take up similar interventions in the field. And I think whatever you share, the experiences, whatever you have put forth as your ideas becomes a model for others who are willing to become the change makers. So thank you, the panelists, Vijayalakshmi, Sahaana, and Sathish, for this wonderful sharing. And thank you, Vedika, the entire Kural 2020 team, for organizing such a wonderful sharing experience. Thank you.
Thank you very much.
Thank you so much. It was an amazing experience.
Thank you. Thank you
all.
so much.
Thank you to connect all.
Thank you for joining us. We have learned a lot. And thank you, Professor Andrew, for so beautifully and smoothly facilitating that conversation. We really appreciate your presence here today. Thank you.